Hi, I'm Dr. Hornfeld. I'm a board-certified ophthalmologist, and today I'm going to talk about high-tech intraocular lenses. Now, this is not an advertisement. It's just a straightforward, candid talk about the options available today, the possible complications or side effects that you can get with these products, as well as the potential benefits. Now, there's a lot of confusion out there, and I'm just hoping that this will clear some of these things up for some of you. First of all, when you get a cataract, what does that mean? We're all born with our natural lenses inside of our eye, and as we age, the lens becomes cloudy, and that cloudy lens is what we call a cataract. Now, if you decide to have the cataract removed, and it is your decision, your surgeon will implant an artificial lens to replace the cloudy cataract. Now, until recently, there was only one type of lens implant, which we call a monofocal lens. What that means is that the lens implant gives you one focal point. So we can choose to either put a lens in so you see well in the distance, but then you need glasses for reading, or you can choose to put a lens in so you can see well for reading without glasses, but then you need glasses for distance. So what we usually did, and we make this decision with the patient, is we decide to, most of the time we decide for something in between, like an intermediate distance. And then if you need a little more help in the distance or up close, you wear some glasses. Now, so the bottom line is that most people still need glasses after cataract surgery, at least some of the time. Now there's a new generation of lens implants. Some are designed to give clear vision for both distance and near without the use of glasses. Some are designed to get rid of any astigmatism in the eye. So let's review some of the products out there. First, let's talk about the multifocal lens. That's the one that gives you distance and near with no glasses. The two main lenses used in the US today are the Restore lens from Alcon and the Technis multifocal from AMO. These are lenses that have concentric circles on it so that when you look to the far distance, it gives you clear focus. And at the same time, it's giving you focus at an object about, say, about 2 feet from your eyes. So if there's nothing there, you're just seeing the distance. If you happen to put a book there 2 feet in front of your face, you'll see the book. So let's talk about what can go wrong with these lenses. The first thing, the most common thing that goes wrong with this lens is that the power that we measure the implant to be can be off. So in other words, it's like wearing glasses that are either too strong or too weak. It is the wrong prescription, which defeats the whole purpose of the procedure. Now, how can that happen? It happens because the formula that we use to calculate which lens we implant is a theoretical formula. It's based on the curvature of the eye and the distance between the front and the back. So most of the time we're pretty accurate, but I'd say maybe up to about 10% of the time we can be off with that measurement. So now if this happens, what do? There's two ways to fix it. One way is to surgically replace the lens, so you have the wrong lens in the eye. So we bring you back to the OR, we remove that lens and put in the correct lens. This almost always solves the problem, but it does mean a second operation with all the same risks involved. The other way to do it is with laser vision correction, which also solves the problem, but carries its own set of risks. Now, the next thing that can go wrong with these lenses, the multifocal lens, is nighttime glare and halos. This can be especially annoying if you drive at night because of oncoming headlights. If you get this problem and you just can't tolerate it, you may need to have the multifocal lens replaced for a single vision lens. That solves the problem, but it also again means a second operation. Now, besides the multifocal lens, there's something called the accommodating lens, which also is supposed to give you distance and near vision without glasses. The most popular one used in the US is the crystal lens. In Europe there's other options available, but as of today they're not available in the United States. The advantage of the crystal lens is that it doesn't have those concentric rings, so the vision is more clear at any one distance, and there's much less likelihood of nighttime glare and halos. So this would be the better option for the nighttime driver. The disadvantage is that while it does give you very good distance vision, it doesn't always work that well for near. Most people find that it gives you good distance and intermediate, but they'll need a little help with some glasses for the near. And there's other people where it'll work for the distance and then it just doesn't work at all for either intermediate or near, which again defeats the purpose of getting that type of lens. And we've seen some very disappointed patients with both of these types of lenses. So with both of these types of lenses, they work best when there's no astigmatism. If you do have astigmatism with these lens implants, you're just not going to see as well as you'd like to see. And the bottom line is that these lenses certainly have made many people happy, but they have also made many people disappointed. So, and also remember that you don't have to use these lenses. You have the option of the single focus lens, which will give you a clear vision after cataract surgery, and it is covered by insurance.